Well, hello, everybody. I'm so glad to have you here today. My name is Josh Mitchell, and I am a program manager with Education Service Center Region 13, and I've also been a health science teacher with high school students for 10 years. And so I'm so glad to have all of you on today. So far, we've got about 14 people in the room today, and I expect that we will probably have some more in just a little while. We tend to have some people kind of pop in as they get their Zoom browsers and everything all hooked up. So once again, thank you for being here, and so happy to share this experience with you today. Today we're going to have two great people working with us on this presentation. Nicole Sutton is going to be our moderator for today's conversation, and you'll hear from her in just a little bit. And then Dr. Amelia Edwards is going to be our guest speaker for today as she shares her experiences as a pediatrician and advocate for Ascension Seton. Before we get started, I do have just a quick agenda, and then I'm just going to go through just a couple kind of housekeeping things before we start with our talk today. But first thing I always like to do is just a quick roll call to see who everybody is and where you're coming from. So if you wouldn't mind, in your toolbar in Zoom, your toolbar might be kind of floating around somewhere on your screen. There should be a button that says chat. And if you open up your chat box, it will allow you to type in your name. And if you could just tell us a little bit about who you are. So if you are a student, what school do you go to? Or if you're a teacher, what school do you teach at? Or if you work for our healthcare system or another employer, please tell us who you work for. It's kind of nice to see who's in the room so that we know how to better direct some of those questions. So let's take a moment to do that. I will kickstart it here in just a second if I open up my chat box. I see lots of good messages coming in. Thank you so much. All right, awesome. I'm sure there'll be a few more that start to roll in there. Thank you very much for taking a moment to introduce yourself so we know who you are and what school or employer you work for. I see I've got a few more people entering the room, so I'll continue to let them in, and we may not hear from everybody and where they're from, but we'll have an opportunity at the end to take some questions. So for today's talk, we'll have an opportunity to hear from Dr. Amelia Edwards on her experiences and education as she became a pediatrician. We're going to have some questions and some answers from our moderator, Nicole Sutton, and I'm also going to pull those up on the screen as well so that you'll be able to see those and follow along with those questions. And then we'll have some time for you to ask some questions as well. So it's going to be kind of a combination of those things. I do ask that while we are in the meeting to please make sure that you do keep yourself muted unless you are the speaker, speaking of course. And as we go through our meeting, I usually suggest that if you do have some questions to post them in the chat box, I think is the best way. The raise hand feature gets kind of a little weird and it's hard for me to get back to it a little bit later. So if you post your questions in the chat box, we will definitely get back to it a little bit later. And do ask that the chat box is used for professional communication only as we are asking questions of our speaker for today. So those are kind of my few little ground rules that I have for working in Zoom. But otherwise, this is an opportunity to ask any question that you have and get the information that you need to be successful in the next step in your career. Before we get started, give me just a second. I gotta fumble through all the Before we get started, I do want to introduce our guest speaker today, which is Dr. Amelia Edwards. And Dr. Amelia Edwards is a practicing pediatrician, and she is the Director of Government Relations and Advocacy at Dell Children's Medical Center in Austin, Texas. She practices primary general pediatrics and on board the Dell Children's Medical Center mobile clinic, which is, I think, a great program to be able to get to children all over the region, where she serves as the medical director. Dr. Amelia Edwards is a graduate of Harvard College, where she graduated magna cum laude with an AB in biochemistry in Harvard Medical School. She completed her pediatric training at Baylor College of Medicine. Prior to joining Dell Children's Medical Center, Dr. Amelia Edwards served as a part-time general pediatric practitioner and urgent care provider at Austin Regional Clinic, a multi-specialty group practice in the Austin area. Dr. Amelia Edwards also co-founded the Texas Center for Prevention and Treatment of Childhood Obesity at Dell Children's Medical Center in 2010, served on the editorial board for the America Academy of Pediatrics Healthy Active Living for Families Project, and was on the steering committee for the Institute for a Healthy Childhood Weight from 2012 to 2016. Dr. Amelia Edwards has spent almost two decades in various roles with the Texas Pediatric Society and the American Academy of Pediatrics. She chaired the obesity committee of the Texas Pediatric Society from 2007 to 2011. Dr. Amelia Edwards also served as the co-chair for the TPS Legislative Committee and has actively participated in Texas legislative sessions, sharing her content expertise and testifying before various state legislative committees on behalf of the Texas Pediatric Society, the Texas Medical Association, and the Texas Academy of Family Physicians on various obesity and other childhood-related bills. In 2012, Dr. Amelia Edwards served as the Texas Pediatric Society president, and from 2013 to 2015 was an alternate chapter chair for the Texas Pediatric Society. In January 2016, she became chapter chair of the Texas chapter of the American Academy of Pediatrics, a position she held until September 2019. And in March of 2019, Dr. Amelia Edwards assumed an American Academy of Pediatrics district leadership position, serving as the AAP District 7 Chapter 4 Management Committee member. It is such a pleasure to have you today, Dr. Amelia Edwards, and we'd love to kick things off by having you tell us just a little bit about your journey from being a student in high school or even K through 12 education all the way to where you got to now.
Thank you so much, Joshua, and welcome everyone. It is so great to see so many names and to see where you're from. I want to give a special welcome to my colleagues at Ascension, Texas. And I did not prepare anything formally purposely because I want this to be an informal discussion. Anyone who knows me knows that I'm an open book. I want to welcome any questions for a couple of reasons. One, high schoolers are especially near and dear to my heart. I have two high schoolers myself, a freshman and a junior. And I know that these are times where you want to be able to ask those very honest questions, and I promise to give you an honest answer. I'm an open book. I'm going to do for you what other people have done in my career as my mentors. So it's really an honor to be here, and can't wait to dialogue with you all. So as Joshua didn't mention, but originally I'm from El Paso. For those of you who don't know, it is the very west of Texas, and yes, it's still Texas, and I claim to be a Texan through and through. No one, kind of to tell you my journey, no one in my family, my sister and I were the first generation to go to college, but there was definitely, if you ask my mom, she will tell you that I was 3 when I said I wanted to be a doctor. I carried around a stuffed animal, my security blanket for many years, and one of my biggest joys was to, take my Pooh Bear into surgery whenever he would get an open seam anywhere in his body because he was just so valuable to me. And she says that that was the seeding of my medical career. You know, I'm very grateful, and I will always give full credit to the mentors, the support, and especially my parents, because going to college was something that my parents kind of instilled in my siblings and I, was just such an important part of our life journey. And, you know, they instilled in us, if you can fly as high as you can, we support you. You know, during my high school career, I just always had, I was one of those people, and you don't need to do this, you know, had just that goal. I was going to get to medical school. I was going to, you know, reach that goal. And my academic experiences led me to Harvard undergraduate. People always ask me, were you homesick? What was that like? And it was fabulous. We'll always, you know, if you guys want, I will always geek out on a separate platform and tell you about that experience, and just encourage all of you to aim for the stars, reach for the stars, because if you don't reach, you may not always get what you want, but you will not be able to stand up tall enough on your tippy toes to reach that. So aim for the stars always in your education. I studied biochemistry, and you know, to be honest with you, again, part of the reason I love having these conversations with students is because one of my biggest mentors was my orthodontist. He actually had gone to Harvard dental school, and you know, said, Kim, you can do this. Let me talk to you. After tightening my braces one appointment, he took me to his office, and him and my mom and I, we just talked about how you got there. So ask questions, look for that mentorship, and I am happy to share my contact information with you all afterwards if I can serve as that purpose. So when I went to Harvard College, I knew I wanted to go to med school. I thought you had to study the sciences, but you don't. My advice to you is study what you want and study what you love and do well. And if after that, medical school is part of that journey, any field of study will fit into that. So study what you love. I went to a summer program before my senior year of high school that was at MIT, and that's where I was introduced to biochemistry. I love biology, I love chemistry, and this merger of those two worlds into biochemistry it just blew my mind. But when I got to college, I noticed, I do love biochemistry, but I love medical anthropology. I love political science. I changed my major so many times because I just could not decide what I loved. And in the end, came back to biochemistry, did a thesis, worked in a lab at Mass General Hospital, where I worked on transplantation between species, which was phenomenal. Look for those opportunities, grab onto those opportunities, even if you don't know at that time, you know, it was a program on xenotransplantation. Did I know exactly what xenotransplantation was? No, I looked it up. I was inspired by that. I pursued that and graduated with honors after having done my thesis there. I stayed at Harvard Medical School afterwards because that is definitely what my mentors really encouraged me to do. I was fortunate enough to take the MCAT and have the opportunity to go to Harvard Med School. But again, to be a physician, it doesn't matter where you go to medical school. It doesn't matter where you go to college. If you love the profession, you will be a successful doctor no matter what you want to do and where you go. Stayed at Harvard Med School, and once you're a Texan, you always come back. So for residency, I had just had it with too many slipping on the snow, needed to come back to my home state of Texas. So did residency at Texas Children's in Houston. Thought I was going to be a hematologist oncologist or cancer doctor, but reunited with my high school sweetheart and decided, nope, I just want to be a wife and go and open a practice. And so did not do a fellowship and came to Austin to start a practice at Austin Regional Clinic. fast forward my career to where we are now as the Director of Advocacy and External Affairs at Dell Children's. When you're a physician, I think one of the things I learned as soon as I started my career was that practicing within the four walls of a clinic is not enough. There's so much more to health and to well-being that exists outside of those four walls of a clinic. And so immediately after starting in my practice, we got some new growth charts that had something interesting on the back called body mass index, which at the time even pediatricians were asking, what is that? And I know all of you know what body mass index is now. My daughter is just so much smarter. She's my junior. And then where I was as a junior, and even my freshman son knows, yes, I know what body mass index is, mama. You know, I started noticing, and none of my partners knew what body mass index was. How do you calculate it? What impact does it have on children? And not being one who accepts the unknown, I dove headfirst into saying, okay, we as pediatricians, we need to learn about body mass index. We have to understand how weight is not just affected by personal choice, but the environment around us, and learning how to help change that environment around us for the betterment of health is really what took me down the trajectory of advocacy, which is really defined as speaking up on behalf of others. And so that made other people tap me in terms of at the American Academy of Pediatrics at the state level. Hey, you're working on this. Do you want to be the chair of our committee on obesity? And then the Texas Education Agency, can you provide expertise for us? And I was the youngest pediatrician who was asked to serve as the president of the Texas Pediatric Society. And then that took me to kind of a national level. The American Academy of Pediatrics opened up doors so that I could serve as a leader in that organization. When I was asked to serve as the director of advocacy at Dell Children's, it was a huge honor. And as Valerie and Tina know, I rely so much on my team there because they have taught me how much to not just engage and be active at a civic level in advocacy, but to really work to take the tactics of whether it's writing an op-ed piece or writing policy, but just have it work for a strategy that really pushes health forward and pushes policy forward. So it's been just a fantastic opportunity to work with the Ascension Texas advocacy team. I couldn't give up my practice because that's really where my heart and my love is. And I went from practicing at Austin Regional Clinic, which was a private multi-specialty group practice for profit, to serve on the Children's Health Express, which is my honor to serve under or uninsured children who don't have a medical home. I know the value of a medical home from my experience as a mother with my own 2 children. And I know from a private practice what I expected to give my patients. And I believe, I don't care if you can have insurance, don't have insurance, what your socioeconomic status is, everyone deserves the same healthcare. So we've really re-strategized our mobile clinic to take this pediatric medical home on wheels to areas of our community that sometimes have a little struggle getting to those. So we come to you, and it's just been fantastic. I would love to elaborate on anything you all would like to know about. That's kind of a very superficial introduction to who I am, but I really want to spend the majority of our time together with you exploring and me being very honest and transparent about what this career is like. It has been very fulfilling. I can talk about the balance between a professional life and personal life. People who know me know full well that my children, my husband, my family are my life. And in medicine, you can balance those two, but you have to be, and I'm happy to give advice on that. So I'm going to open up the floor. I know, Nicole, thank you so much for moderating this session. You had some questions, but then I would love to hear from the students and participants to ask me any question that you had.
Awesome. Well, I'm going to pull up the questions here. I appreciate that introduction. Thank you so much. And Nicole, I'll make these a little bit bigger so you can also see them too.
All right, so I've polled several students and counselors and other teachers to kind of see what they really wanted to know. And the first question to you is, what classes and or skills are vital for students to learn in high school to ensure that they can be confident going into any health field?
So I think my first recommendation is to share that there is not a cookie cutter response or a cookie cutter number of classes that you need to have taken or not taken. I think the most important advice I can give, and I've interviewed for Harvard undergrad since I graduated, and I tell every single high school student this: more important than what class is how you're doing in the class. Are you really investing in yourself to explore the passions that you have? You know, you may have a passion in history or literature, and to see you blossom and succeed in your interests is probably more important than a specific class itself. And I would really emphasize that. Now, just being very, very honest and open, even before medical school, I don't think I knew the process of even all the specialties in medicine. Because part of your journey in exploring a medical field is to learn about the field, to learn about the options there. And I caution against pigeonholing yourself to one specific area, but study what you love, because that is how you will succeed. And have conversations with people like me who can tell you, this is what medical school was like. These were good points. These were bad points. These were struggles. These were, this is what I love about my job. This is what makes it challenging in my job. Pursue those opportunities to have those just very honest conversations.
Thank you. My next question is, many students are interested in engineering and information systems. But I know that there's a growing field that connect the medical field and information systems. What careers are available that cross over between those two fields?
And I promise we did not coordinate these questions, but just so you know, part of my interest in college was actually biomedical engineering. So as embarrassing it is, it was one of the 5 concentrations that I had during my college career, because yes, there's a lot of just merger between these two fields. You know, as I think about information systems, my husband's an electrical engineer, and I value his input with things like electronic medical records, with new processes, new procedures for addressing medical conditions, you know, in the operating room. I think there are just, engineering and informatics is just so integrated in medicine that even if you're not a practicing clinician, you can absolutely be in the medical field with those kind of career choices and interests in mind. Absolutely.
Thank you. My next question is, many students are interested in a hands-on approach to learning and very much interested in internships and volunteering. So first question to that is, do you know of any opportunities that are available for high school students to jump in early on? And then second of all, you had mentioned mentorships. I know a lot of our students are very interested in having a mentor to kind of guide them as they're navigating what they want to do and where they want to go to school, especially those in the health science field.
So I think, you know, in terms of opportunities, I think the landscape has changed. I'm older, guys. And so I can say in the last 30 years or 40, 35 years since I was a high school student, the landscape has changed. And I think it has become a little more challenging to do internships and volunteerism just with new rules around HIPAA and privacy and things like that. And now, especially with COVID in our field, even volunteers, medical students, residents, it's changed our landscape quite a bit. In fact, medical students are just coming back next week because they went to a lot of online learning, which really changed how we're doing things. So with all that in mind, I think there are some challenges right now that are very real for opportunities for volunteerism. I don't know, Dell Children's has a volunteer department, and I've always utilized them to help sponsor or assist high school students, because there were actually some very specific, and forgive me, I didn't look this up before I joined you all. There was a program specifically for high schoolers through Dell Med and Dell Children's. My suspicion is that it's on hold right now, but I would not hesitate to encourage each of you, if that's of interest to you, to call up our volunteer office, because there is a process to become a volunteer. After a certain number of volunteer hours, you are able to shadow physicians. And I had, and again, talking about mentors, the worst thing to do is to not ask. And if you specifically I had a really wonderful relationship, as I shared, with my orthodontist. My family practitioner, who kind of saw all of us grow up, I remember tapping him and say, Dr. Puig, what is it like to be a doctor? Ask the questions. It does take a certain amount of boldness, but from my perspective as a pediatrician, oh my gosh, I love when somebody asks me those questions. I will sit down with them. There was a college student 2 years ago who heard me do a lecture, and she came up and said, can I come shadow you? And I said, well, I don't know how that works yet, but let's take you through the process. It took her 1.5 years to, fill out all the volunteer hours with our volunteer department. She shadowed me 1.5 months before we had COVID hit. And then that ended. But it doesn't mean that her and I didn't develop a wonderful relationship where I just wrote a letter of recommendation for her for med school. So it's just asking, it's being bold. It's always uncomfortable, but if you don't do it, you won't even have that opportunity open. So I know there are different stereotypes of pediatricians versus surgeons, but in general, I think we are all wonderful people, and we just love that opportunity. So tap us on the shoulder, ask, because it's just our pleasure to do that.
Thank you. So my next question is, what is something that you wish you knew as a high schooler that you know now, or what advice would you give to high schoolers, especially those going into the medical field?
Great question. I think that a lot of times, a lot of us can be very professionally driven, and I have very open conversations with med students, residents, male, female, about the true reality of learning to balance professional and personal life. And there are not many discussions going on around that. I think there are more now than back in my day, but to share a little bit more about my own personal journey, I had been, so yes, I had a lot of debt coming out of undergrad and college. I mentioned my parents did not go to college. I did have the benefit of some scholarship, but I came out with quite a bit of debt. Got married, and a year after I got married, and we combined all our debt, and my husband almost fell off his chair, but he loved me so much he was okay with that. I had my first child, and was on maternity leave for 3 months, came back, and again, forgive me for sharing so much, my mom was going to take care of her. Who better than my mom? But I remember coming home, it was after one of my first days back, and she said, Mija, Sally laughed. And I just cried, not because of anything other than I missed it. And I called up my chief of pediatrics, my boss, and I said, Walter, I'm quitting. Because no one had told me, how do you balance this? How do you balance that desire? And I will always be, again, even as an older adult, I've had mentors. He said, Kim, you're too good of a doctor. You cannot quit. And I said, but this is my priority. Keep your priorities always as your North Star. My priority are my children and my kids. And he was so kind. He said, hey, can I create a position for you where you work in the evenings and on weekends at our after hours? My husband's home and I would be home the rest of the week and days with them. I said, absolutely. And I saw no hope. I thought, oh my gosh, I'm giving up my career. But he created that position for me, and I will always be so grateful to him for that. There are now 20 after hours only physicians at ARC, so you kind of paved the way. And those of you who know me know that my family comes first. I am so passionate about my work at Ascension. I'm so passionate about children, but I cannot take care of other children if I don't take care of my own. And no one talks about that. It's a struggle. It's figuring out how do you balance all that. But to have very open conversations is something I wish somebody had done, because I was devastated to want to stay home, but to give up this career with this much debt and leave that on my husband's shoulders. No one told me that was possible, but it is if you keep your priorities, whatever it is, whether it's your family, whether it's your, I don't, everybody defines their own priority, but never lose sight of that. So.
Thank you very much. My students, most of them are first generation Americans, and the concern of debt and work-life balance and having to choose between one or the other, I think they very much appreciate that answer.
If I can just elaborate, this is what I tell everybody, do I drive a Ferrari? No. Do I drive a Mercedes? No. But am I happy, and was the debt manageable? Yes. I am not in want. Until I worked for Ascension, I never worked full-time, because part-time was the way I balanced my family and my career. I don't have a, lake house, but I don't need that. I'm very content. So it is very, very possible. It's staggering to look at your debt and be like, oh my gosh, I've never even seen those many numbers strung together, but you can do it. So yeah, I just encourage, please don't let that scare you off.
So my last question, excuse me, is I see that you've spent a lot of time and effort raising awareness for childhood obesity, and especially in light of what's happening right now. I think we're calling it the quarantine 15. What advice would you give to school districts and teachers and students in regard to physical health and nutrition and exercise?
The first piece of advice that I give is physical health, nutrition, exercise are all part of health, and you cannot separate those. Through actually my church, I actually had the privilege of doing a little bit of a Be Our Voice obesity lectureship in Del Valle High School. So Del Valle is super near and dear to my heart. Because that all starts early on. It's a part of life. You get up, you brush your teeth, to go outside and, take a walk, to be very intentional with, your time right now. We are all stuck together in a home, and to just be very intentional to go out with your family, to go on a family walk, is super important. I think we are all probably eating out a lot less than we were in the past, but I definitely have seen and appreciated what you quarantine 15. That's right for all of us, because we're snacking a lot more. Some of my suggestions to my families and clinic are, gosh, especially when we are in quarantine, keeping a schedule sleep schedule, because that's one of the things that I've seen just really go out the door. Keeping a schedule in the summer, just like you do for the school year, whether you're in quarantine or actually at school, same bedtime every night, get plenty of sleep, because that's very associated with your health and weight. And then going so far as to set a schedule for meals, 3 meals, 2 snacks, for most of us is sufficient. Because if you guys are like me, you're at home, you're like, oh, I can have 10 snacks in a day, and you just lose sight. But if you even put up a schedule on your fridge, and then think about what you're eating, gosh, you guys probably all know this, but I always recommend the plate method, where you have a plate and half of it is fruits and vegetables. Even for snacks, think of half your plate always having fruits and vegetables. Think of snacks as fruits, vegetables, and protein, which is peanut butter or yogurt or a glass of milk, along with your fruits and vegetables, so that you kind of get the recommended servings of fruits, vegetables, and fiber that help keep you fuller, that really utilize nutrition as an opportunity to optimally refuel your body. And to be honest, because a lot of times eating is around other issues, maybe not hunger, but as a coping mechanism, anxiety, depression. We are all isolated, and I think that's very hard. Having open, honest conversations about that, especially for high schoolers. I like I said, I have 2 high schoolers myself, and I know what it is like to not have your social support in terms of your peers around you, and how there is a mourning process for that. And be open with your feelings, your emotions, so that some of those coping mechanisms of going to maybe eating and food are instead utilized through conversation.
Thank you very much. I appreciate that.
Yes, ma'am.
Yeah, thank you so much. I love all your perspectives, and that was very enlightening on thinking through just how to eat and also sleep during these times when our schedules just may be all out of whack at this point.
Mm-hmm.
Advice. And even during the summer, students, as you get off for the summer, your sleep schedule may change dramatically, and staying on a consistent schedule can really make a big difference. What I'd like to do right now for the audience is open up the floor to any questions in the chat box. So you can type your questions in there. And what I'll do is I'll go ahead and moderate those and ask them as they start to come in. But while we are waiting for those, I had a question that I was thinking about. And you do a lot of work outside of being a pediatrician with the Texas legislature and politicians. What is it like working with politicians? Was it a steep learning curve? Like, how did you learn how to navigate that world?
Again, I'm one who dives in when the need is there. So I think early on, it was through a lot of my obesity work that as a physician, you have a voice that sometimes we don't appreciate, and a certain expertise, and more importantly, stories that you can share. So, gosh, I think actually my daughter was 6 weeks old when I first got a call to testify at the legislature for the state chapter of the American Academy of Pediatrics, because I remember having to balance that. Was I nervous, shaking in my boots? Absolutely. But basically, I remember, if I'm not mistaken, it had to do with child nutrition standards in schools. And basically, I just told the stories. I told the stories of the children that I was seeing in my clinic who had, slipped femoral epiphysis problems, or slipped hip joints from their socket because of weight. I told about my kids who were having diabetes at very, very early ages that I had not learned in residency, and I had just finished, was possible at those early ages. I've learned that working with legislators, they have expertise in the legislative process, and I value their partnership to bring policy. But as a physician, I am an expert in children and their health, and can contribute not only that expertise, but the stories that their constituents are facing. Still have to do some deep breathing before I testify at the legislature now, but and again, thanks to the relationship with the Ascension Texas advocacy team, have just learned and had many more opportunities to engage with them, to talk with them outside of the legislative process. Just yesterday, we had a Zoom call with Congressman Williams' staff, and he's a federal representative in the House of Representatives in the U.S. That's very second nature now. It's just partnerships and sharing with them what we are seeing on the ground level.
I really appreciate that insight, because it is important that as we think about developing our careers and growing in our careers, that we do have sort of that growth mindset and willingness to jump in and try new things. And I think that's a great story of how you were willing to do that and jump in and try something new. So that's absolutely amazing. Audience, is there any other questions? Any questions that you all have?
Joshua, I see a question in the chat box. Would you like
Okay.
me to answer it?
Yeah, actually, I'm glad you saw that, because for some reason the chat's not working on my side. So I do apologize. I didn't realize one was coming in. I'm sorry.
No.
But yeah, if you can see it, that would be awesome. Thank you.
Sure. Thank you so much for the question. I'm going to read the question. It says, how is the transition from high school student to at Harvard? Phenomenal. It was, I'm very much a homebody. I'm very close to my family. Definitely struggled with, at that, I wasn't able to come home for Thanksgiving. I wasn't, necessarily able to come home for spring break, but it was such a new opportunity. I knew what I loved in terms of education. And I think part of it was, I was definitely that kid in the candy store. Wait, what? I have the opportunity to go hear Mikhail Gorbachev speak. Wait, what? I can go and do xenotransplantation research. Wait, what? I can go and hear, opportunity after opportunity after opportunity. Regardless of where you go to college, it's a time to explore. There are opportunities that you need to seize. There are, and it makes it worthwhile. It makes it so worthwhile, and you grow from that. You learn from that. I worked during undergraduate, probably we didn't have cell phones back then, if you can believe it. But I had $300, $500 worth of telephone bills, because I would call home so often, because it kept me connected with my support system. But it was fantastic. Having been from El Paso, I can tell you that I did well academically for El Paso. I was in public schools, and very quickly was humbled and kind of maybe blown away a little bit by some of the educational experience of others around me there. You have private schools like Choate and other Northeast schools where I could not believe the high school experience they had had. But what I loved about my experience at Harvard was, regardless of where you came from academically, regardless of where you came from socioeconomically, religiously, politically, there was such respect for each other that we all started on the same playing field. So part of the beauty of it was to learn from each other. I loved my classes at Harvard, but what I loved even more was the relationships I built with my roommates, with other classmates, where we challenge each other. Why do you think that about this? Why are you saying that? Not in a confrontational way, but just a growing way. There were so many different perspectives. I tell this story because I still chuckle at it. I remember so many people asking me when I got there, what are you? I'm like, wait, what? What am I? I'm Kim. I'm a human being. They're like, but are you Lebanese? Are you Jewish? are you Hispanic? And, nobody, and you just teach each other about beautiful parts of culture that maybe other people had not been exposed to. And it was just so fulfilling that it kind of helped with that homesickness that definitely was there. And as a Texan, I can tell you, my roommate in my freshman year was from New York. And a Texan, we're very friendly. You walk onto the subway, you smile at everyone, you say hello. And I very quickly learned I remember her grabbing my hand. She said, "Kim, don't do that. People think you're crazy." So I learned I had to not be as friendly, but that's why I moved back to Texas. So
that's funny. I had kind of the same experience. I lived in Seattle, and it was you didn't say hi to people, but in Texas you do. So that's
yeah.
really enlightening. I finally was able to get my chat box pulled up. It was hidden behind another window, but I had a private message from Jerry Faber, who is from Weiss High School, and he was asking, what was it like first going into the medical field? And he gives an example of what was your first time experience like being in a clinic or when you were hired for your job. What did that feel like?
Again, being the first in my family to go to medical school, I did not know what to expect. I had a glorified vision that medical school was going to get me to what I wanted, which was to be my general practitioner who took care of my family. And it was difficult when I walked into my first anatomy class and did gross anatomy and saw the beauty of a person's body that they had donated so that I could learn. It brought me to tears. I remember how hard it was just to, you learn about a person in a very vulnerable way when you see a pacemaker and you have to dissect it out, or when the colleague next to you has a beautiful body that has had a mastectomy, and you can only just guess at what their life story was. And it was an appreciation for life and this gift that was emotionally hard. And to be vulnerable and share those conversations and feelings was very real, or when you go through medical school and you go through a clerkship where you have to hold the hand of a woman who is having a spontaneous abortion and just to live her pain with her, or the reality of walking with the family when they receive the diagnosis of cancer. And these are some of the things that come to mind when I think about medical school that was truly transformative. I was not ready for that because for me, medicine was all about healing and the positive. But to be able to experience that and learn from it and to make you that much more empathetic and understanding when you, as a pediatrician in my own clinic, had to tell a family, your child has a brain tumor. You walk with them, you love them, you are there for them. And it's all those experiences that really defines who you are as a physician. I hope that was, I answered that question for you. And if not,
I think that's great. It's so important to think about the emotional aspect of those first times and those human interactions. So I think that is a great explanation of what it means to have that kind of first experience in the medical field. So thank you for that. We've got a question from your colleague Tina at Ascension Seton, and she asked, Dr. Kim, what is one piece of advice you can share with students deciding on what healthcare career is best for them? It's a two-part question, so I figure we could start there.
So I think medicine is all about working as a team. I'm a firm believer that it's not physician, nurse, respiratory therapist. We work together on a level playing field, because I, as a physician, could not do what I do without my nurse, with my respiratory therapist, with my child life specialist. It is so important that you recognize the value of being a member of a team, regardless of what healthcare field you go through. Our surgical techs, our radiology techs, critically valuable for the work we do to heal our patients. And so I think there can be the misperception that, oh, I need to be a doctor to be in the healthcare field. Oh, no. Oh, please, you will find what your love is in terms of, you know, having these experiences. What do you like, you know, spending more time with your patients? Is nursing, is respiratory therapy more your calling? Is an anesthesiology tech, a medical assistant? Everyone is a critical member of the healthcare team, and base your decision on what career is best for you based on what you love and not perceived status, if that makes any sense.
That's a great answer. And you kind of also answered the next part of the question, which is thinking about what students should consider as part of their decisions as they transition from high school to college. And you talked about that love for the profession and really finding something that really just kind of connects to you. Is there any other advice that you would give for students transitioning from high school to college as they make this decision?
Again, my biggest piece of advice is not to feel like you have to make the decision now, because you may get exposure to some other part of the healthcare field that down the line you may say, hey, I might want to do that, and give yourself that ability to explore other options in the healthcare career, in the healthcare field. Again, even when I started medical school, I did not know all the different types of physicians and specialties that were available. And it would have been a tragedy to not, actually, most of my family works with children. I think there's something inherent in my genetic makeup that makes us love children. But I seriously entertained neurology because I just thought that was fantastic, and did not even think about that going into medical school, that I might like neurology. And I seriously entertained that because you know, for those of you who like the, you know, neural pathways, and it just makes so much intuitive and inherent sense. If you get a stroke here, this won't, you know, function. Give yourself the ability and the leeway to entertain more than the one thing you think you want to do.
Awesome. Thank you. That is a great piece of advice, and always keeping that book open to explore and find those new opportunities. Well, it looks like that's it for our questions for today. But as we wrap up, I just wanted to take a moment to thank you, Dr. Amelia Edwards, for talking with educators and students and professionals in the area about your career. And Nicole Sutton from Del Valley ISD, thank you so much for moderating some of the questions that you pre-planned. And I also want to give a shout out to the staff at Workforce Solutions and Ascension Seton for helping us put together this speaking series that we are doing through the month of June. This has been a very eye-opening experience, and just wanted to kind of make a plug for this, but the Workforce Solutions Capital Area does have a YouTube channel, and as we go through and do these talks, we will be posting those on the YouTube channel for others to view at a later time. So thank you again, and everybody have a great weekend. Enjoy yourself. It's going to be hot, but not too humid.
Thank you
Get some
so
exercise.
much for this opportunity. Yes, thank you so much for this opportunity. And, you know, if anybody has any additional questions, or please don't hesitate to reach out to Tina, to Val, my friends at Ascension, Texas. They know how to find me, you know, and it would be my honor to answer any other individual questions. So thank you all for your time. Thank you for your passion. And maybe I'll be much older, but I can't wait to hopefully work with some of you down the line. So really great to meet you. Thank you for this opportunity. Have a great day.
Take care. Thank you.